Hi, my name is Ben, physical therapist here at Total Physical Therapy. And if you have had low back pain in the past, you have probably had physical therapy help you be able to get stronger, more flexible, get more functionality, and get back to all the things that you want to be able to do in life. And I don't know about you, but in my situation, I see many times where I'll give certain activities and exercises to patients, and they will go home and they will work on it for a little while, but then they will end up not doing it and end up back right where they started from. And this is a very unfortunate cycle that happens in physical therapy from time to time. And today we're going to be looking at a study that basically addresses the idea of what we call patient adherence, or the ability for somebody to be able to stick with a program and keep working with it over the long term. This research study is going to be looking at the middle term effect, or over a span of time that's not long term but middle term, and providing a patient with an education program and seeing if it helps them be able to have more adherence to that program once they are done with their care. And basically the research study came down to this. One group gets the exercises and some sort of physical therapy care. The other group gets that same care plus an education program. Broke it down into three different types of education. One was teaching you about the importance of motivation. Another one was teaching you about how to manage your activities of daily life. And then another one was talking about how to manage physical activity. They basically looked at the follow-up rates of these patients over a 3-month span and a 6-month span. The results of the study basically come down to this. Because each of the groups were performing physical activity and exercise, they saw improvements in their strength, their flexibility, and their functionality scores. However, upon 3-month follow-up, the group that had the education program saw less people drop out compared to the group that did not have the education program over the span of 3 months. And of the people that followed up, the people that had the education program saw improvements in a variety of different factors, from strength and functionality and those types of things. However, if you looked at the middle term follow-up, or following up around 6 months, both groups saw exactly the same amount of follow-up, as well as similar types of improvements in their functionality and strength scores. So what can we make out of a study like this? Well, obviously their intended intervention of providing an education program was effective for the short term, over the span of 3 months. However, if we're looking at it to show any improvements over the long term, it's going to be questionable on whether or not that an education program is going to allow us to be able to have results long term. One of the things that they theorized could potentially help have more adherence to the program in the long term was the idea that maybe as the participants were performing their exercises at home, they got used to it and they don't see any progression any longer as they are doing the same exercises. And we have talked about this previously in the channel before on a bunch of other videos that we have talked about, and that's the idea of progression. Whenever we are looking to try to take somebody from where they are to where they want to be, we always want to make sure that we are consistently challenging somebody along that process. If I give you an exercise and you are doing it for a period of time, how strong you get will determine on how challenging that exercise is. If I want to see improvements beyond that initial task, I need to be able to challenge you further and be able to make it harder by increasing how often we're doing it, how long it takes us to do it, or increasing the intensity of the exercise. And the authors of this study admit that potentially, if there was some way for us to be able to show that we could improve the program that has been given to the patients over time, that this might increase the adherence to physical therapy and to physical activity moving forward. And that being said, I want to give 3 simple tips for maintaining your adherence to physical activity once you're done with physical therapy. And the very first one is being clear on your goals. You need to have a good idea of what your ultimate goal is. And it needs to be something that you can measure and is specific. For example, my goal would be my wife's harp. One of the heaviest things I have to interact with on a fairly consistent basis is being able to lift and handle my wife's harp, which is about 83 pounds. And so whenever I'm exercising and I'm working out, I have that specific goal in mind, because I know that if I stop working out and stop doing things, it's going to be really hard for me to be able to handle my wife's harp and do different things that she wants me to do with it. Whereas when I'm exercising, I know that I'm going to be able to keep up my ability to be able to maneuver and handle her harp. The second tip that I would offer to you is being able to track that progress towards your goal over time. Every once in a while, check in to see how well you are doing. And depending on what your goal is, would determine what type of test that you want to be able to choose to be able to determine how well or how close you're getting to your goal. If, for example, one of your goals is a walking goal, I want to be able to walk a certain distance. Well, every month or 2 months, check in to see how close you're getting to that goal. Another way to be able to check to see how well you're doing is if one of your goals is strength, maybe check in every 1 to 2 months by doing a 10 rep max test. This is simply where you take as heavy a weight as you can and lifting it 10 times and try to see if over time that weight improves or increases. If it's increasing over time, then the amount of work and the challenge that you're giving yourself with the activity is appropriate. However, if you are declining over time or it's staying about the same every time, well then maybe we need to change up your activity and what you're trying to do to get to your goal. The third tip I would have to be able to stick with physical activity is simply just to keep it fun. If you are not enjoying what you are doing, then chances are you're probably not going to keep up with it long term. So if you are reflecting upon your activities and different things that you've been provided by a physical therapist and you're thinking, it's really not that fun. As a physical therapist, there are ways that we can be able to keep an activity more engaging for you. So if you are not feeling engaged or that it's very fun, just bring that up with us and we can definitely figure out ways to help keep that more engaging. If you guys liked the video, give us a thumbs up. If you guys have any comments or questions, leave those down in the comment section below. And as always, I hope you guys have a great day.